Well, good morning and thanks for joining us. It's Monday, right? So that means it is Medicare Monday, and who better to talk to about Medicare than Gary Smith with the Gary Smith Agency. Good morning.
Good morning. Thank you for having me.
Well, thanks for being here. So we're talking about Medicare. Let's jump right into it. When we're discussing Medicare and why people need Medicare, we also have to talk about the ancillary products.
Correct. Yeah, these are going to be products that you don't typically see talked about during the commercials, right? This is not your Medicare Advantage, not your Medicare Supplement. These are going to be things that people don't think about. Life insurance.
Oh.
Dental insurance, right? Let's talk about life insurance just for a second. Obviously, Medicare does not provide you with life insurance. Social Security does at a whopping $250, right? That's it. So obviously that's a gap, right?
Sure.
So the ancillaries could be think of like a gap. Do you need a hospital indemnity plan, right? If you have a Medicare Advantage, do you need life insurance? Like you said, do you need a cancer policy? Dental is a huge one, right? Because Medicare does not cover dental. It's probably our #1 request. Do I need dental insurance? Or I need dental insurance, and most of the time as a senior, when you need dental insurance, we think dental insurance is expensive, let me back that up, dental care, right? You think dental care is expensive at 30 years of age? Wait till you're 65, 70 years of age. It's the cost just, because I guess you need more things.
Sure.
And so sadly, most of the people in the dental world, they're needing $8,000, $10,000, $15,000 worth of dental work. And sadly, not any insurance will cover that.
What about long-term care?
Long-term care is another one. So in our society, here on the Gulf Coast, and of course all across this nation, we're getting older. Everyone's getting older. I think everyone has experienced dementia, or my father personally now doesn't have dementia. He has a heart condition that's causing him to have major memory issues. He's actually in a care facility. Medicare does not cover long-term care. And for a lack of a better words, as when I'm talking to people, I say the way you can kind of distinguish between long-term care, the actual long-term care versus what Medicare will cover, is Medicare will not provide babysitting services. It's just, and I hate to use that word,
sure,
right? But that's the best way to get people to understand it. Medicare does provide 100 days of rehab, right? And that could be in a long-term care facility. So for a lot of your listening audience out there, that's my biggest phone call and confusion. Dad's been at the nursing home receiving long-term care for the last 100 days and we haven't had to pay anything. Now we're getting a bill. And I have to say, well, probability your father was in the nursing home receiving rehab, and Medicare covers 100 days of rehab. Sadly, the rehab has expired. Now it's actually gone into, custodial care, long-term care, because your father is probably not capable of leaving, because of dementia, heart attack, strokes. You don't have he can't get up, as I tell people, he can't get up out of bed without help.
Sure.
And we all have to go to work. And so while we would love to care for him at home, we just can't. Right? If we could care for them at night, but then what do you do in the daytime? So yeah, long-term care is a huge problem, and it's an expense that people should plan for. Whether you're buying insurance or talking to your local financial planner, right? How are you going to cover this expense that Medicare does not cover, whether it's care at your house or care at a long-term, at a nursing home facility? Probability is the lucky ones are playing golf, struck by lightning, have a heart attack, and we're gone quickly. But that's unfortunately probably not the bulk of us. Most of us are probably going to be like my father, who has been having memory issues going on a year now with a heart condition.
Right.
And the medication's keeping him alive. He's good days and bad days, and we want him to live as long as he can, right? Of course we do.
What are some of the biggest misunderstandings that you hear about with these specific types of plans?
When you're looking at the Medicare Advantage plans, who include a lot of dental, a lot of people will come in to buy an Advantage plan based off the extra benefits that you always hear and advertised. And one of those extra benefits is dental. A lot of them are over-the-counter benefits, but the biggest one's dental. And that is as I always explain to the clients, you're buying a health plan for basically $0 or $20, $30, right? That includes $3,000 worth of dental care. Do you honestly think you're going to get $3,000 worth of dental care in a plan that's less than $30? It's also covering your health care. I mean, stop and think about that for a second.
Sure.
If it sounds too good to be true, it probably is. And invariably, people find out that, yeah, it was too good to be true. And there's a simple answer for that. In these dental plans, we all are now familiar with network of doctors and hospitals, right?
Sure.
Unfortunately, exactly. But the dental plans have a network. Well, unfortunately, here on the Mississippi Gulf Coast, there's not many people in these networks. And that's not just here. That's Alabama, Texas. The people who join the networks are corporate dental facilities like Aspen Dental. And now when you go to a town like in Atlanta or Houston, you have more Aspen Dentals than you do mom and pop. Here on the Mississippi Gulf Coast, Alabama, in the smaller communities, we have more mom and pop dentists than we do the big corporate dentist. And it's just hard for all these mom and pops to join the thousands of different networks. So invariably in these dental plans, you're always at a network. And the problem there is literally a $3,000 dental benefit is honestly about $700, $800 in real care. People don't understand that.
Right.
And it's hard to talk about that. We just try to tell everybody when you're looking at all these extra features like the dental and the Medicare Advantage, think of it like a bonus feature, right? You bought the plan for the health care. Your doctors are covered, your drugs are covered, and now it has dental. It has an OTC benefit. It has some other benefits that are built into it. If you go to the dentist and got to get a root canal, if they give you $50 or $100, say thank you and move on, right?
Sure.
You got to get the root canal regardless. And they're not going to pay $800, $900 for this root canal. Even if you had a real dental policy that you were paying $50, $60, $70 a month for, that dental insurance policy is still not going to pay 100% of the cost on that root canal. It's insurance, right?
It is. It's insurance. That's a lot of information. Look, if you want to learn where the Medicare gaps exist, you have more questions, scan that QR code, call the number at your screen, and let Gary and his team go to work for you. Gary, thanks so much.
Yes, sir. Thank you for having me.